Hey everybody, Dr. Tam here, your pain specialist and chiropractor here in Vacaville, California, where every single week I like to give you tips on how to improve your health, function, and also your longevity. Of course, decreasing pain at the same time. So, what is the big problem here in the US right now in the health industry is the overuse of pain medication, opioids, NSAID drugs, right? The numbers have gone up and up. Now, do I believe that we have a pain medication problem? Well, yes, but it's not the pain medications themselves that is causing the problem. It's the overprescription of pain medication that's causing the problem. And what's the number one reason? Number one reason why people are using pain medication for musculoskeletal pain? Number one, here we go. It's lower back pain, okay? That is the number one musculoskeletal pain that people are using these drugs for, right? I mean, when you look at this, I think there is a lack of common sense right now in our health community because most people are thinking that, you know what, let me just throw some pain pills at this and see if it helps. If it's inflammation, let's throw some pain pills at it. Now, if you were to ask yourself, what does pain medications actually do? Here's how common sense will actually kick that to the curb, all right? Say you have lower back pain, right? And your doctor or someone that you know says, hey, try this medication. Ibuprofen, Motrin, Advil, try this medication, see if it helps. The goal of a medication is to remove pain by covering up the pain, okay? So that, you are no longer feeling it, right? It's masking the pain. It masks the pain. So, for example, in your car, right? I like to use car analogies because a lot of people drive. If you start hearing your brakes squealing out of control, right? They're just screaming. Every time you brake, they're like, wow, just screaming. And the only thing you do is, hey, you know what? Let me put some earplugs on so I don't hear the brakes anymore. Well, is that going to fix your problem? No, it's not. Common sense. Common sense is telling you, no, that's not correct, and that will not fix the problem, right? Because you know that eventually, if your brake starts to squeal, that means your brake pads are wearing out. And if you put on the best headphones and earplugs, your brakes are going to be a problem one day, right? Now, that makes sense. That doesn't make sense to do in your car, right? Why does it make sense to do on your body? Why is it that the number one thing that most people do when they have pain is take a medication? What problem is that going to solve? See, I see that as doctors, we should be solving these problems and correcting these problems, not merely just covering up the symptoms. Now, what's worse is when the medications are not doing their job. Well, now you move to the next step. What's the next step? Let's inject some steroids in you, right? Why are steroids being used? Steroids are ultimately being used to numb and deaden nerve endings. That's the goal of a steroid. When patients come to our office, they tell me, well, the first steroid worked really well. It lasted like 3 to 4 months, and then the second one didn't last as long. Well, that's because the first one ate away the nerves, the sensory nerves that go to your brain, so your brain can't sense it and feel it anymore. But at the same time, you know what else happens? It degraded that joint or bone and blood vessel or muscle or ligament. It degrades it. It eats it away, literally eats it away, right? Depletes the oxygen, starts eating away the tissue, okay? And now what happens when the cortisone wears off? You think you're better off? Structurally, you think you are better off? Do you think you have more blood vessels, oxygen, ligaments, and muscles in that area? I hope your answer is no. because it's going to be a lot less, right? So then the second time the cortisone's injected, that joint in that area is so much worse off that your body's like, wait a minute, this is a huge problem, right? You can shut me up for a while, but I need to tell you what's going on. And people think that the cortisone did not do their job. No, it did its job. It deadened the nerve endings the first time. And the idea of a cortisone way back in the day is not just to numb out the pain, it's to numb it out momentarily so you can do what you need to do to fix the problem. It's not meant to fix the problem on its own, right? But we're utilizing it completely out of context. Going back to the brake analogy on your car, cortisone is like spraying, hey, you know what? You know your brakes are bad, but let's just spray some WD-40 on it, right? Your brakes won't work as well. Over time, it might degrade the brakes and rotors even more, but you know what? At least I won't hear the squealing. Now that doesn't make sense, does it? So if you really want to solve a problem, you need to seek out advice from someone who has done problem solving, that it makes sense. That's going to do what it takes to correct the problem, right? You know, is it the problem? Is it the facet joints behind the back? Is it jammed? Is it the disc? Is it the alignment? Is it muscle weakness? Is it scar tissue jamming up that spot? What is it? What's the real problem here, right? So until next time, guys, use common sense. Tell your doctors to use common sense as well, right? Don't accept just a pill or just a shot to numb the pain and do nothing to correct the problem. All right? Hopefully this conversation has helped you improve not only your health, your function, but also your longevity. Until next time.